We learned from the state health department today that 800,000 more doses of COVID-19 vaccine are headed to Texas next week.
But as the state expands access, state health authorities say we will actually receive fewer first doses next week. KXAN's Jennifer Sanders takes a closer look.
Mayor Rogers and her husband are over the age of 65 with heart and lung issues. Their son has a rare disease requiring infusions every 2 weeks just to keep him alive. After signing up on multiple lists, they still can't get a vaccine.
My husband is disabled. I'm on disability. My son is on disability. We're not physically able to go and stand in long lines to get a vaccine.
Those lines are expected to get even longer after eligibility expands to people ages 50 and up next week. More demand, but smaller supply. State leaders announced Thursday fewer first doses will arrive in Texas next week.
This is happening for two different reasons. The federal government has sent out all the Johnson & Johnson vaccine that have been manufactured this week, so states are getting a lot less J&J this coming week.
Almost half of Texans 65 and up still need to get the first dose if they choose. And the federal government also directed pharmacies to prioritize school and daycare workers during the month of March, as well as those in phase 1A and 1B.
We won't be getting any additional extra vaccines specifically for these populations.
But there is some hope on the horizon.
We do know that the vaccine supply is going to be increasing in the coming months. And so we just need you to hang on there for a little while longer. More vaccine is coming.
Jennifer Sanders, KXAN News.
DSHS is expected to release allocation numbers and locations tomorrow. The agency expects to move through phase 1C much quicker because the state says it's a smaller population and there are more vaccines available right now than early on. And they said the reason they opened phase 1C is because that group is also at significant risk of severe disease, hospitalizations, and deaths.